Good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN Weekly for Saturday, October 29th, 2022. It's been another great week of great guests and, of course, great topics. We kicked off the week with a look at the economic loss from smoking. Let's take a look.
The cost of tobacco use is not only reflected in the morbidity and mortality caused by the diseases that it inflicts upon people. It also has substantial cost in terms of the health expenditures that are needed to treat those diseases. And also people lose productive time when they're sick or when they die prematurely. And not only that, there are costs on household level productivity that are not paid in the market, but that is the cost that the caregivers at house provides to those who are ill in their family. And on top of that, people incur significant trauma and loss of grief, of losing someone near and dear ones. Those are the costs that we cannot measure, but those are reflected in their overall reduction in productivity as well. So we try to capture those in terms of an economic loss concept, which is like monetizing these costs and capturing all of these components in one measure. And that's what we try to do in this article. This cost is going to go up because as the cancer burden grows, it is in an epidemic form now. And the more and more people are affected, the overall cost is going to go up. But also the per capita cost in the US is the highest in the world. So that is quite dramatic because, this cost is ultimately borne by either the person and the family themselves, but also by the society as a whole, because some of these costs are funded from the taxpayers' money. The part that is covered by the government through Medicare or Medicaid programs, those are also the costs that are spread over the entire population. So there are both individual costs and societal costs that we have to be mindful of. If you look at the loss of unpaid household productivity, that's pretty much what it is covered there. And the individuals or family members taking care of the patients in their family have to give up a lot of their market productivity as well as household productivity, and somebody has to forego that time in the family to take care of the sick. American Cancer Society also has thousands of volunteers across the country who provide service for taking care of the cancer patients and for all their traveling and visiting doctors, picking up prescription drugs. Those are the costs that are not captured in the GDP, or per capita personal income that we talked about in this paper. So we actually estimated that how much that caregiver's cost might be in terms of loss of household productivity because of the morbidity created by tobacco use. When people who are on the side of the freedom of choice or consumer sovereignty, they speak about giving people the freedom to pick the products they want to use. But this is the kind of product where you cannot completely apply the freedom of choice or be sovereign about it, because you have got to worry about your closest family people. Not only that, you are imposing a lot of cost on the society as a whole. Even if you cannot connect yourself to them, they are bearing the cost directly or indirectly. So yes, this is a concern not only for individual health and economic loss. It is about the loss to the families and the society as a whole, the nation as a whole.
Next up, we discussed how one retirement executive applies the lessons of the 2008 financial crisis to savings and retirement today. Let's take a look.
This is clearly an important topic for Broadridge, but also obviously for the industry and also for the country. And as you mentioned, I'm president of the Mutual Fund and Retirement Solutions here at Broadridge. And just quickly, for those that may not know who Broadridge is, we are a global fintech leader. We deliver technology-driven solutions that drive business transformation for banks, for broker-dealers, asset and wealth managers, among others. And we've been doing this for about 6 decades now. So we've been through a lot and seen it all. And personally, I've been in the financial services space for about 25 years, having spent time in consulting, banking, and even academia, which really gave me an opportunity to understand and lead within the industry from several different facets. I also spent time working for the government during the financial crisis in 2009, when I worked for the U.S. Department of Treasury at the Troubled Asset Relief Program. It's also known as TARP, serving as Director of Investments. So working at the Department of Treasury was particularly meaningful to me because it really provided an opportunity to serve our country when our economy and financial markets were going through a particularly volatile time. And for me personally, as someone who grew up in an immigrant family, and I benefited from sort of this idea of the American dream where you go work hard and progress upwards. And so I wanted to use my financial services skills and know-how to work, not only for the government, but also to see the benefits that it would have on everyday Americans. So if you recall, the TARP program, it was created to provide investments to the banking system and financial institutions such as Bank of America, JP Morgan, Citi, and others. And the fact of the matter is that those investments really worked. And the thing that I'm most proud of as being part of a team, and this was, both with Hank Paulson and then Tim Geithner's team, so this is really cutting across multiple administrations, is that the team really implemented policies and worked directly with financial institutions to not only help stave off an economic disaster, but also it did so by prudently using taxpayer dollars. We took the TARP program and really paid the American people back, right? And with interest. And so we really accomplished multiple things, which is, on the one hand, helping sort of save the economy, and the other hand, doing so really prudently. And so for me personally, it was really a formative period in my career. And it really drove home this importance of retirement in this country. And one of the things now bringing back to today, which is like, when I think about the role that I play, and what really gets me excited is the ability to work for an organization like Broadridge that makes a difference in the retirement space. And, I talked about my immigrant upbringing, but growing up, my parents and our family, we didn't really have financial security. So, there were times when we could barely make ends meet, and not to mention, being able to save for the future. So, being at Broadridge, being able to provide technology solutions for financial services firms, which really enable Americans more broadly to save for retirement, that's personally meaningful for me.
Yeah.
And part of what I do enables better financial lives for many families like the one that I grew up in. So combining my personal background with what I did in the government, it all definitely shapes my perspective on retirement and how I come to work every day. I mean, there are really many dynamics that are playing out right now in the workforce. And I do think that the biggest problem is the condition of the U.S. retirement system. And, I don't know, on your program, you probably talk about this quite a bit, but, there is a pretty wide retirement shortfall of about, estimates have it about $4 trillion. And so the market volatility that we've seen over the past several months has certainly put extra focus and pressure on this gap, but it's really a trend that's been creating challenges over time. And so, when I think about, sort of the big trends here, the first one really is something that's talked about quite a bit, which is just, Social Security, because that's really one element of this, which is really the potential of the inability for Social Security to pay for retirement benefits. The GAO, they forecast something like 2.9 trillion, the $2.9 trillion Social Security fund. It's going to be depleted sometime in 2034. And so really, if there really isn't any sort of mitigating factors to alleviate those pressures, I think this is going to be a problem in the not so distant future. That's kind of one thing. The second thing is demographic, right? We're seeing an aging population, improved life expectancy, and that is really just putting some more pressure on individuals to save more money. And certainly coming out of the COVID pandemic, it's certainly impacted this as well. There's a PwC survey which found that 56% of baby boomers, they really believe that they would have to continue to work after retirement. And I think that's just another proof point and evidence that, there are real pressures that retirees are facing. And then lastly, I think really the key challenge related to this big retirement shortfall is just a lack of access to employer-sponsored funds, defined contribution plans. That is really the majority of how individuals accumulate retirement wealth. But only 64% of private sector employees really have access to a plan and are just not fully invested. So, you have 656,000 defined contribution plans, but you have 4 million entities that have no plan. And that's just a real gap, right? And with pension plans, they're really no longer as prevalent as in the past. And so, individuals really just need to think about security and particularly financial security when it comes to their future. And so, Secure Act 2.0, think that legislation, and there's key components of that which we really should be on the lookout for. And I do think that there are elements of that will help address this gap.
Well, we're halfway through our best segments for the week. We come back, we take a look at the other half. You're going to want to stay tuned right here on BRN Weekly. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms? Especially for the smaller businesses. I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score? A credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
Welcome back. Next up, we discussed tips to save on your next dentist visit. Let's take a look.
Hopefully, if you've been putting off your dental checkup, you're getting it. I mean, one thing I think people can maybe relax a little bit about is, you hear the like 6 month, every 6 month dental visit. That's not necessarily a hard and fast rule. It's a good rule of thumb, but there's evidence to suggest that, some people may need less often, some people may need more often. So, it's not a hard and fast rule. Of course, if you have access to dental insurance through your employer, it's a good idea to go ahead and take advantage of that. Less clear of an advantage is sort of buying private dental insurance. That's really expensive. It's not clear that it's going to save you a lot of money, but there are some other options. There's a thing called Dental Savings Club, which is a little bit like a membership program. You enroll for a nominal annual fee, and then you have access to a bunch of different dental discounts depending on what provider you're seeing. So Dental Savings Club is a really good option. And then there's a few other things you can do, if you aren't in a hurry necessarily to get care, it's a good idea to check out local dental schools, dental schools and dental hygiene schools. Those students are learning about how to clean teeth and take care of teeth, but they are supervised by professional dentists and professional hygienists. So it can take longer because they're learning. It can take time to get in for an appointment. But that's another good way to get dental care kind of at a lower cost. So I don't know very much about the cost of x-rays specifically, I have to say. That's something that I haven't looked into. I mean, your insurance, if you have, again, employer-sponsored insurance, it's likely that dental x-rays are covered. I don't know that there's a need to sort of get more dental x-rays beyond that unless you have a specific issue. So, if you get told you have a root canal, you need a root canal or something, they should definitely be doing an x-ray to make sure. That's one of the things that you would want to see them do to make sure that they're telling you you need a treatment that you actually need. So, x-rays definitely have a role, but I can't speak more to necessarily the cost.
And finally, how to make an impact with those charitable donations. Let's take a look.
There are a lot of people making a lot of donations to a lot of places, and we've only seen that number go up over the past few years with the pandemic. And some of the things that we know about that are it's really hard to find information to make those choices. So folks end up going with somebody that they've heard of or that they know, or their brother is on the board of this thing or whatever. They tend to give when they're asked, and they tend to just kind of do it kind of ad hoc. So a lot of folks don't necessarily have a plan for how they're going to donate, and they may or may not be thinking about impact. And what I mean by impact is what kind of return are you going to get for your money? What we would love to see at my organization, Impact Genome Project, is a way for people to find organizations that make the kind of impact with the people that they want to see, changes in. And right now, you're right. It's a lot of who do you know? It's a lot of, if you're a big organization that has marketing budget, it's a lot of, even just getting the funding. Do you have a good grant writer? It's not necessarily about impact. And that's not to say that the big organizations are not producing impact. But the point is that it's really hard to find, especially those like small grassroots community-based organizations that are probably doing a lot of good, that are putting all of their resources into doing good and not necessarily advertising. So one of the things that we want to do is introduce data and metrics into the decision-making process and essentially lift up those organizations that are having really big impact and highlight that so that people can find them. And one of the ways that we do that is through a registry that we have. And the idea is to essentially, it's like shopping on Amazon. Like you can filter down to what you're interested in. If you want to buy a computer, you can, filter down to the right size screen and the hard drive and all these things. And we don't really have a good way of doing that in this space. And that's one of the things that our study was testing was, what if you give people that kind of information? Will they use it the way that they might on Amazon to really narrow down and take all of that information into account? Or are they just, for example, going to go with the cheapest program or the one that sounds the best? We get our data from a few sources. One is the 990 tax forms. So that does give us some information and things like where do they operate, how big of a budget, but more importantly, what outcome are they focused on and how are they doing that? We can sometimes find that information. But our bigger data source comes from the nonprofits themselves. So one of the really important concepts here is standardization. And I think people in the space can sometimes feel a little uncomfortable with that idea, like, oh, we can't standardize because every program is unique and every person's situation is unique. And that's true. But when you look across the whole nonprofit sector, there are common things that people are trying to fix, right? There's food security, there's housing, there's financial health, there's education, there's all of these things. And there's really, in our opinion, and through our work, we've seen that there's a finite number of outcomes that folks are working toward. And what I mean by outcome is a change in status, behavior, or condition of most of the time an individual person. Sometimes the outcomes have to do with organizations or governments or things like that. But for this conversation, let's just think of a single person. And if you think about something like food security, there's a definition of what that means. It's going to be the same definition no matter who you are. The way that you get to that might be different. And the way that you measure it actually might be different, but the concept of what it means to be food secure is the same. And so what we've done is we've standardized those definitions. So you can then parse apart something like food security, which is different from getting a meal, which is different from getting groceries for a month, which is different from eating healthy. Like all of those things are part of food security, but they're actually different outcomes. And so at Impact Genome, we don't standardize the measurement per se. What we standardize is that outcome concept. And so once you do that, you can bring in data from nonprofits or from 990 tax forms, and you can essentially translate that into this common language of these standards. And so when you're able to do that, you're able to aggregate all of that up, you're able to compare, you're able to benchmark, you're able to do things that in pretty much every other industry is a normal, typical thing, responsible thing to do, where you're making decisions based on data. But that hasn't happened as quickly in this sector as we would like, and that's part of what's motivated our work. Yeah, and we do have clients that we work with where that is how we work with them. We essentially take in either before a grant is made. So if folks are coming in and applying for a grant, we can tell the funder, here's the range of people that are applying or organizations that are applying. And going back to the food security example, you have a bunch that are focused on soup kitchens and getting those as needed access to meals. And you have a bunch that are more weekly or monthly food. And which of those are you most interested in supporting? Because they are different. Or are you interested in supporting the infrastructure and distributing food? And that's also different. And so the idea is if you can bring this information in, you can bring in information on like how much does it cost to get an outcome? Where is this happening? What is the outcome? And you can make those kinds of comparisons. And again, if you are an organization or even an individual and you have a strategy, you have something that you're really interested in funding, this just makes it a lot easier to find those places that are doing that exact thing. So we're bringing in a lot more precision to this process that has traditionally been fairly emotionally driven and very difficult to find information to really inform.
That wraps up this episode of BRN Weekly. Have a topic of interest, someone you think we should talk to? Drop us a line. And don't forget, for all the latest curated news and lifestyle, wellness, finance, tech, entertainment, so much more, and all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? We'll visit our website. And of course, all of our streaming partners. We're back again tomorrow for BRN Sunday. I'll be joined by members of the media, academia, financial services, and government as we analyze all the news and events for the week. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.